Hi, my name is Erica Kirkland, and this is my reflective video for Class 701 Theoretical Foundations for Advanced Occupational Therapy Practice. A little bit about myself. I've been a therapist since 1993 and have mostly practiced in acute hospital setting. I've also worked in nursing homes, and I have done some home health as well and worked in burns and trauma. But currently I'm working in an acute care hospital here in Birmingham, Alabama. I was in group 3, and some of my classmates were Christy Huneman. She also practices in a rehab setting. Alex Hollis, she's in acute rehab. And Susan Johnson, she is a school-based occupational therapist. And Patrice Patton works part-time taking care of her elderly mother and father and her special needs daughter, and then she also works home health. So we had a very wide area of expertise and practice, and we had a lot of great group discussions. I think the biggest takeaway from this course is in learning the different models is how important it is to consider our roots for occupational therapy, and that we are more focused on and being occupation based and not getting caught up with the medical model that currently there's such a push for being more cost effective, being quicker, being faster. Patients are spending less time in the hospital. Everything needs to be more efficient, and we have less resources. It just makes everything so fast-paced and rushed, which is difficult to do OT in that particular setting. Oftentimes, I really struggle with wanting to do more with the patient, but due to the limitations of having to see so many patients in a day and being productive, it makes it difficult and challenging. And I think we have to fight for the fact that we need to have more time with our patients, and that it is necessary and it's valuable. But also making every moment count. I really enjoyed learning more about the person environmental occupational model, the PEO model. I feel like it was very straightforward and easy to follow. I do find that it was a little bit tricky to use in acute care setting. I felt in talking with Patrice that it would really be great in the home health setting since you're in the patient's environment. Also, I like MOHO, obviously. That's the model that I was most familiar with, and that's probably one model that I tend to really use in my when I'm practicing. I feel like it is so important that patients have motivation to do what, some of the tasks you're having them do, and that they're not bored and they're excited about it, and making it something that they're willing to do and excited and wanting to do. One of the models that I found was quite challenging, but also I learned a lot from, was the occupational adaptation model. And I have found that sometimes I have a tendency to be so quick with my patients and helping them to achieve their goals, and almost making the goals for them and saying, we're going to work on this, this, and this, rather than asking and making sure that those are the goals they also want to work with. And I think the occupation adaptation model is more about the therapist stepping back and really understanding and getting to know the patient and looking at their context and their environment and really digging deeper into their psychosocial and finding out more about that patient and how we can help them and what their goals are and helping to achieve those goals and make adaptations as necessary. I think sometimes it's difficult when you have a patient that is not as motivated as we'd like. I think that makes that particular model very challenging and frustrating. Anyway, I've had a wonderful experience this semester. I've learned so much, and I find that I've been more introspective and considering what I'm doing and not just going through the motions, but really being thoughtful in making sure that I'm listening to my patients, and I'm really focusing on helping them to be as independent as possible, and what their and finding out what their goals are and what's meaningful to them. So it's been a great experience, and I appreciate it so much. Thank you. Bye-bye.